guys, welcome back to Medical Coding with Blue. Today's episode is all about, is medical coding a right career choice for you? If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, I get the question a lot. Blue, how do I know if medical coding is actually a good career field for me? Well, it's not always cut and dry, guys. I don't really know if medical coding is going to be the right field for you. And sometimes you may not know for a while that medical coding is actually the right field for you. But I will tell you and share with you today some of the things that medical coding does involve. It does involve a lot of reading. Now, reading you have to enjoy doing when you get into this field, because of the simple fact that it is 90% of what we do in a day is read. Now, sometimes people don't hear me when I say this, and I say that because I did get a comment today from a viewer who has been following me for quite some time and left plenty of comments, but she now says that she just heard me say that you have to love to read, and she says she absolutely cannot do this because she doesn't like to read. Well, this is the main activity of what we do all day, is we read and comprehend medical documentation. So we have to know medical terminology, we have to know anatomy, and we have to understand pathophysiology. Now, if you don't come from a background of medical, it is okay. This field is actually open to anyone who is willing to do their studies, okay? I did not come from a background of medical. I was very far away from the medical field when I first started, so I wanted nothing to do with medical, and somehow I ended up finding myself in the medical field. Now I do deal with the health information side because that is what I do. I am a medical coder. I code in the outpatient setting. I code for a hospital. I have a lot of experience coding in many different specialties. So being a medical coder is not going to just pigeonhole you into one particular specialty. You are going to, in order to be a high caliber medical coder who has plenty of opportunity, it is going to require you to have lots and lots of experiences in different specialties. And so that's what we do. We get tested on all specialties. So we are not just, specialized in just one. I have been doing orthopedic and podiatry coding for many years, but I have also worked in a lot of other clinics like pulmonary and neurology, and I've helped out in many other clinic settings as well. So having all of these experiences allows me to be able to explore my options with other places to work. And so in order to be able to have that as a medical coder, you have to be willing to fall. There's going to be times when you're not going to understand things. There's going to be times when you're not going to feel the most smartest in the world, but it is what happens when you are learning. And that is something that some people are unwilling to go through. They don't want to go through not knowing. They would rather just take a test and a test tells them that they know, and then they never have to study again. That is far from what happens in our field. In our field, you have to be willing to take the test, and then be willing to, when you're applying for these jobs, you're going to be tested again and again. Now, what happens when you get tested again and again with these employers is they have to be able to gauge your knowledge. And for some people, they get resentful of this because they say, well, I've already taken a medical coding certification. I should be already just in the door because, I'm qualified. But not everybody has the same level of knowledge, and not everybody has the same level of skill either. So that's why these employers take the time to test their people, because if they're going to make as much as medical coders make, they are going to want to make sure that they are sufficiently trained and they know at least what they're doing. Now, one of the biggest things that will happen to brand new medical coders is that they will run into that you need experience in order to get this job. And a lot of people are always going to be asking for experience. If your normal disposition is that you get discouraged so easily, this may not be the field for you. because there's going to be a lot of doors that are closed on you in the beginning. And this is just something that happens in the industry because there are so many really fast-paced medical coding programs out there. These employers have to be very careful about who they hire. Now, what happens is even coders who have experience can sometimes actually lack the skill that a brand new medical coder has, because brand new medical coders are going to be trained in everything, and they've just been tested and they've just passed their proficiency exam by getting certified. And when this happens, this person's going to have all of this knowledge. But a person who's been working for years in the same clinic and not really, stretching their knowledge base, they are the ones that are going to be not as knowledgeable as somebody who is newly trained. So there's a lot that new medical coders can offer, but if you're not out there proactively applying for jobs, even though they're asking for experience, it's going to leave you out in the cold. So you have to be somebody who is willing to accept the challenge of, having those doors closed on you. I've already said many times all the alternative positions that you can get into as a medical coder. I've also mentioned that, you can go to the temporary agency, because that is how I got my first job. And a temp agency is not manpower, okay? It is not day labor. When you go on an assignment for medical coding, it is typically going to be for a few months. And sometimes it's going to be maybe for 60 days. It really all depends on what the client needs. But all of that experience can go onto your resume, and then you can start making those connections. You can start building your resume from there with medical coding experience, and that is how you end up getting your forever home job. Now, the other thing is when people are just really kind of wanting to get into this because they want to work remotely, they want to work from home, and they don't think about what the employer needs and what the providers need. Now, yes, there are a lot of remote medical coding positions, but they are typically reserved for those who do have lots of experience. Now, when the pandemic hit, there was a lot of brand new people out there, and there was a lot of people who retired. So the industry did need new coders anyway. And so a lot of new coders without experience were able to start at home. Now, I've always recommended that if you're going to start out brand new as a medical coder, that you need to be with other medical coders. I will always insist that. I will always say that. But there's a lot of people who want to insist on working at home. I want to work at home and I want to work part-time. Two things, again, that are reserved for those who do have experience. So if you dig your heels in and that's all you want, you may be looking for a long time, okay? So get into the field, but be willing to work at a place where you have to physically go, and then spend some time training around other medical coders, and then work at home, because that's going to be a better and more positive result for you. There's a lot of people who miss out on being around other medical coders, and they're missing out on that knowledge that you don't get from a program, that you don't get from working with workbooks. There's nothing better than being around other medical coders and absorbing that knowledge that is on, in real life. So, that's what you want to make sure that you don't miss out on that, okay? Don't cheat yourself from that experience. At least that's just my advice anyway. But it takes a lot of study. It takes a lot of diligence, especially when you are studying for these exams. This is not a very easy field at all. And it's going to give you a challenge. It will always give you a challenge. We have to know what doctors know while never having gone to medical school. That is the number one saying that I have said, because that is my saying. I said that. I have said that, and I've said that because it's true. We have to read these notes. We have to be able to interpret this documentation and put it into codes. And if this isn't something that is for you, there's a ton of other things that you can do, okay? But I'm letting people know who is really serious and who really wants to know that this is what this field involves. This field involves a lot of study. And this field involves a lot of, that rejection in the beginning when you're trying to apply for these jobs. It's not going to be immediate, guys. It's not going to be immediate unless you're out there really being proactive and making those connections. You can make those connections in a number of ways. And again, I have a ton of videos on my channel talking about how to do those things. So that's what I would suggest is you go through the videos. It's going to take a lot of research. If you are not a researcher, meaning that you always feel like you need to go to somebody to ask them, to have them tell you what to do and things like that, again, this field is going to require the people who get into it to be self-reliant and to be able to know how to do their research. Because just because somebody says, oh, this is the way you code it, and you don't do your follow-up to make sure that that's actually true and that they are actually interpreting the rules correctly or the guidelines correctly, you could find yourself in, a world of trouble too. Because you cannot just say, well, so-and-so told me that this is how we code it. Did you make sure? Because when you look at the ethics that we all have to follow, it does say that we will always code to the most highest specificity, and we will always code accurately, because that is what we are required to do. And these codes, they update every single year, and the guidelines do change. And with time, these things evolve and get different. So because of that, you have to be willing to roll with the punches, and you have to be willing to say, okay, I'm going to accept this because this is part of the deal. This is part of what I do. And this is part of this field. So that's the thing that you guys need to know. This is not a very easy thing to get into. I'm not making this video to discourage anybody, but I'm just kind of giving you an idea of what it is like, and what are you going to be willing to accept. The things that are the easiest are not always the things to pursue, right? The more, challenging the task is, the greater the reward. And certainly that is the case with medical coding, especially for me. When I look back at my career, as far as I've come, I've really developed professionally and personally. It's not just about like thinking that, when people get upset, that they're upset because I did something, and it's not because of that. It's when you take the time to learn about people and things like that, it really does help. The Arbinger Institute helped me to see that it's not about me. It is about other people. And when other people get upset, sometimes that is the way that they react, but it again has nothing to do with me. So that helped me to kind of better focus on, okay, if it's not about me and it's about this person and they're having this reaction to how I'm trying to teach them, then this means I need to change my approach. And that has helped me to be able to reach people who were considered and deemed unreachable. I've been able to reach them because I have taken the time personally to learn. Okay. So again, it is a learning field. It is not something that is going to ever get dull or boring, because you always have to learn. And the more that you devote time to it, in learning and practicing, the better you're going to get at it. No, it does not have to take over your life. No, you don't have to give up everything in order to be successful with this. You certainly can have a life, and you certainly can do other things. You can have hobbies, you can have all these other things. But when it comes to this, and when it comes to bettering your craft, you do have to make time for it. That is undisputed. At least that's just my advice anyway. I want people to be successful. And, I get people who tell me all the time, well, Blue, what you said, it scared me and things like that. Guys, if it scares you, those are the most exciting things, right? The things that scare you, the things that, make you dig deep and have to really think about what you're doing, right? When you're studying, or when you're taking the exam, or when you're out there trying to get your first job, those, again, the rewards are great, but it's not meant for everybody, right? It's not meant for everybody, because not everybody wants to have such a high challenge. And for me, it gets better and better every time. I'm in a career field where I don't feel like I'm working. And I have not felt like I've been working since 2014, when I had my aha moment. That is when I realized that it wasn't just a job, it was a career and a passion for me. Okay. And not everybody gets to that point in their careers. Not everybody does. For some people, they work a job and they work it their whole life until they retire. And then when they retire, sometimes they feel so bored and like, oh, I should have done something else, or I should have done this, or I should have done that. Guys, we only get one rodeo. That's it. This is not a dress rehearsal. This is the real deal. So you have to make your job choice, your career choice, whatever you want to do, you have to make it as best as you can, okay? And like I said, sometimes you're not going to know. And sometimes you may feel a little bit overwhelmed by the challenge, but it's about facing those challenges head on, because you can do anything it is that you want to do. And to be so happy in a career, you know, it takes a lot, and there's going to be a lot of give and take. For me, there is still a lot of give and take, but it's a journey that I would never change for anything. At least that's just my advice anyway. So best of luck to you out there. If you are out there going to get into a medical billing and coding program, I strongly recommend that if you are thinking about going through a program that is going to charge you $17,000, $18,000, $19,000, $20,000 for a medical coding certification, I strongly recommend that you look at the associations themselves and consider going through one of them, because you can go for a fraction of the price. It's roughly $5,000, give or take, for AHIMA or AAPC online. You can also do the independent study video, so independent study syllabus that I do have in the description box of all of my videos. It has all the books that you need, and it's got the template, the study template on, you know, how long you should spend for each subject, and it's broken down. If you go through the whole thing, you can finish it in 9 to 12 months. So that is always a good amount of time. I do not believe in fast-paced programs. 9 months, 12 months, or 18 months is a sufficient amount of time to learn medical coding. And that is a great amount of time, because there is so much to learn. Okay, so with that said, I'm going to go ahead and wrap this one up. But thank you guys so much for joining me. If this video helped you, I hope that you will like and subscribe and share. And I will see y'all next time. Bye.